Question 1. A client on amiodarone therapy complains of cough and shortness of breath. What is the nurse's best response? A. Notify the provider immediately. B. Instruct client to use an incentive spirometer. C. Document the findings and reassess in 2 hours. D. Encourage deep breathing exercises. Answer. A. Notify the provider immediately. Question 2. Which teaching point is most important for a client prescribed alendronate? A. Remain upright for 30 minutes after taking. B. Take with orange juice to aid absorption. C. Take at bedtime with food. D. Avoid calcium supplements during therapy. Answer. A. Remain upright for 30 minutes after taking. Question 3. A nurse is preparing to give insulin glargine. What is the correct administration technique? A. Administer subcutaneously at the same time daily. B. Mix with regular insulin in 1 syringe. C. Administer only after meals. D. Inject intramuscularly into the thigh. Answer. A. Administer subcutaneously at the same time daily. Question 4. A client taking tamoxifen for breast cancer reports leg pain and swelling. What is the nurse's priority action? A. Assess for signs of deep vein thrombosis. B. Reassure the client and document the complaint. C. Elevate the leg and apply heat. D. Encourage walking to relieve the pain. Answer. A. Assess for signs of deep vein thrombosis. Question 5. Which client would require the nurse to clarify an order for metoclopramide? A. Client with Parkinson's disease. B. Client experiencing nausea. C. Client on anticoagulant therapy. D. Client with gastroparesis. Answer. A. Client with Parkinson's disease. Question 6. Which finding is most important to report in a client receiving epoetin alpha? A. Hemoglobin of 13.5 g/dl. B. Slight fatigue. C. Blood pressure of 180/96. D. Decreased appetite. Answer. C. Blood pressure of 180/96. Question 7. A client is prescribed methocarbamol for muscle spasms. What teaching should the nurse reinforce? A. It may cause urine to turn brown or green. B. Take on an empty stomach in the morning. C. Avoid all dairy products. D. Report constipation immediately. Answer. A. It may cause urine to turn brown or green. Question 8. A client taking ciprofloxacin reports heel pain and difficulty walking. What is the nurse's priority action? A. Hold the medication and notify the provider. B. Encourage increased fluid intake. C. Apply ice and elevate the foot. D. Document the complaint and reassess later. Answer. A. Hold the medication and notify the provider. Question 9. Which instruction is essential when teaching a client about the use of a scopolamine patch? A. Apply the patch behind the ear. B. Place it on the upper arm. C. Remove and reapply daily. D. Use only when symptoms are severe. Answer. A. Apply the patch behind the ear. Question 10. A nurse is preparing to administer sublingual nitroglycerin. Which action is correct? A. Place the tablet under the tongue and do not chew. B. Swallow the tablet with a full glass of water. C. Administer with food to prevent nausea. D. Apply to the skin for continuous effect. Answer. A. Place the tablet under the tongue and do not chew. Question 11. Which medication should be avoided in a client taking lithium? A. Hydrochlorothiazide. B. Acetaminophen. C. Loratadine. D. Docusate sodium. Answer. A. Hydrochlorothiazide. Question 12. A nurse is teaching about phenytoin. Which finding indicates need for immediate action? A. Gingival bleeding. B. Drowsiness. C. Skin rash. D. Headache. Answer: C. Skin rash. Question 13. A nurse prepares to administer an intramuscular injection of haloperidol. What is the appropriate site? A. Ventrogluteal. B. Deltoid. C. Vastus lateralis. D. Dorsogluteal. Answer: A. Ventrogluteal. Question 14. What should the nurse teach a client prescribed tetracycline? A. Avoid dairy products within 2 hours of taking. B. Take the medication with iron supplements. C. Take before bedtime. D. Use aspirin for headaches while on this drug. Answer: A. Avoid dairy products within 2 hours of taking. Question 15. Which client is at highest risk for toxicity when prescribed theophylline? A. Client who smokes regularly. B. Client with seizure disorder. C. Elderly client with heart failure. D. Obese client with diabetes. Answer: C. Elderly client with heart failure. Question 16. Which nursing action is priority for a client receiving for magnesium sulfate for preeclampsia? A. Monitor deep tendon reflexes. B. Monitor liver enzymes. C. Encourage a low-fat diet. D. Check for jaundice. Answer: A. Monitor deep tendon reflexes. Question 17. A client is prescribed colchicine for gout. What symptoms should be reported immediately? A. Severe diarrhea. B. Mild abdominal bloating. C. Increased appetite. D. Headache. Answer: A. Severe diarrhea. Question 18. Which instruction should be given to a client starting isotretinoin therapy? A. Use 2 forms of contraception. B. Increase intake of fatty foods. C. Take with vitamin A supplements. D. Avoid all dairy products. Answer: A. Use 2 forms of contraception. Question 19. A nurse is caring for a client on clozapine. What side effect requires immediate attention? A. Sore throat and fever. B. Constipation. C. Sedation. D. Increased appetite. Answer: A. Sore throat and fever. Question 20. Which lab value is most important to check before administering enoxaparin? A. Platelet count. B. Hemoglobin A1C. C. Serum sodium. D. Creatinine clearance. Answer: A. Platelet count. Question 21. A client taking ACE inhibitors reports swelling of the lips and tongue. What should the nurse do first? A. Stop the medication and notify the provider. B. Reassure the client and apply cold compress. C. Ask if the client has a history of allergies. D. Check for rash or skin changes. Answer: A. Stop the medication and notify the provider. Question 22. Which finding indicates digoxin toxicity? A. Nausea and blurred vision. B. Constipation and headache. C. Weight gain and insomnia. D. Muscle cramps and thirst. Answer: A. Nausea and blurred vision. Question 23. What is the nurse's priority before administering furosemide for? A. Check potassium level. B. Measure glucose level. C. Assess skin turgor. D. Review INR. Answer: A. Check potassium level. Question 24. Which teaching point is essential for a client taking isosorbide mononitrate? A. Change positions slowly to avoid dizziness. B. Stop taking it if chest pain resolves. C. Take it only with meals. D. Avoid taking it on an empty stomach. Answer: A. Change positions slowly to avoid dizziness. Question 25. What is the best response when a client on prednisone reports black tarry stools? A. Notify the provider due to potential GI bleeding. B. Reassure the client that this is harmless. C. Recommend antacids for relief. D. Encourage fluid intake and observe. Answer: A. Notify the provider due to potential GI bleeding. Question 26. A client on metformin is scheduled for a CT with contrast. What is the correct nursing action? A. Hold metformin before the procedure. B. Administer metformin immediately after. C. Encourage fluids and give as scheduled. D. Double the dose the night before. Answer: A. Hold metformin before the procedure. Question 27. What advice is essential for a client taking phenazopyridine? A. Expect orange-red urine discoloration. B. Avoid taking it with dairy products. C. Monitor for increased salivation. D. Take it on an empty stomach. Answer: A. Expect orange-red urine discoloration. Question 28. Which adverse effect should be monitored in a client on aminoglycoside therapy? A. Ototoxicity. B. Constipation. C. Insomnia. D. Tinnitus. Answer: A. Ototoxicity. Question 29. Which instruction is appropriate for a client starting fluoxetine? A. It may take several weeks to see effects. B. Stop taking the drug if insomnia occurs. C. Use alcohol to relax if needed. D. Skip doses if feeling better. Answer: A. It may take several weeks to see effects. Question 30. A client taking ferrous sulfate reports constipation. What is the best recommendation? A. Increase fiber and fluids. B. Take the medication with milk. C. Reduce the iron dose. D. Use a heating pad for abdominal pain. Answer: A. Increase fiber and fluids. Question 31. Which medication should be avoided in a client with a history of serotonin syndrome? A. Tramadol. B. Acetaminophen. C. Ibuprofen. D. Diphenhydramine. Answer: A. Tramadol. Question 32. A client taking hydrochlorothiazide reports leg cramps and fatigue. What lab value is most important? A. Potassium. B. Hemoglobin. C. Sodium. D. Calcium. Answer: A. Potassium. Question 33. Which action is most important after administering a rectal diazepam for seizure? A. Monitor for respiratory depression. B. Document seizure length only. C. Encourage oral hydration. D. Place the client in Trendelenburg. Answer: A. Monitor for respiratory depression. Question 34. What teaching should a nurse provide for a client on levetiracetam? A. Do not stop medication abruptly. B. Avoid eating bananas. C. Take only when symptoms occur. D. Combine with aspirin to enhance effects. Answer: A. Do not stop medication abruptly. Question 35. A nurse is reviewing medications for a client with heart failure. Which drug can worsen this condition? A. NSAIDs. B. ACE inhibitors. C. Diuretics. D. Digoxin. Answer: A. NSAIDs. Question 36. A client taking hydralazine develops dizziness and palpitations. What should the nurse assess first? A. Blood pressure. B. Oxygen saturation. C. Bowel sounds. D. Reflexes. Answer: A. Blood pressure. Question 37. What should the nurse instruct a client prescribe warfarin? A. Avoid green leafy vegetables. B. Increase potassium intake. C. Take aspirin for headaches. D. Double the dose if one is missed. Answer: A. Avoid green leafy vegetables. Question 38. A nurse prepares to administer naloxone. What is the correct priority? A. Monitor respiratory rate after administration. B. Check liver enzymes before giving. C. Keep the client NPO for 6 hours. D. Administer with benzodiazepines. Answer: A. Monitor respiratory rate after administration. Question 39. A client is prescribed carbamazepine. Which lab test requires immediate action? A. White blood cell count. B. Potassium level. C. Creatinine. D. Bilirubin. Answer: A. White blood cell count. Question 40. What is the most important instruction for a client starting bupropion? A. Report any history of seizures. B. Take with a high-fat meal. C. Increase caffeine intake. D. Stop abruptly if insomnia occurs. Answer: A. Report any history of seizures. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.